Today we're going to demonstrate how to do a head and neck assessment. The first thing you start is with the hair, and so you're noticing the color. Her color of her hair is brown, and you're feeling the texture, which is smooth and it's long. The other thing you're going to look at is their scalp. So you're going to notice the condition of their scalp, and you're also going to palpate for any lesions or bumps that she may have. And I always like to try to look around the hairline to see if they have any nits or lice there. And she doesn't, so it's good there. The next thing I'll look at is her face, and I'm just noticing facial features to see if they're symmetrical. And then I'm going to palpate her sinuses to see if there's any tenderness. When I'm palpating, you tell me if you feel any tenderness. Okay, so I'm doing her frontal and maxillary sinuses. Any tenderness? No. Okay, so she doesn't have any tenderness in her sinus areas. The next thing I'll look at is her eyes, and I'm looking to see that they're symmetrical. I'm looking at her iris to say they're blue, and her sclera is white, and her conjunctiva is clear and shiny. I also notice that she doesn't have any edema or ptosis of the eyelids or any discharge. Do you wear contacts or glasses? No. And she has no prosthetic for her eyes. So I'm looking at her nose and see that her nose is properly aligned. And then I'm going to look up in each nares, and I'm looking for redness, swelling, or discharge. And I'm also looking to see if there's any nasal flaring, of which she does not have any. And then next I'm going to look at her ears. And so I just palpate her ears, just around. You have any tenderness there? No. And I mainly want to make sure that I palpate the pain. Right here is the tragus area. It's just a little triangle looking area in front of the ear. And tell me if you have any, I'm palpating on that. Do you have any tenderness? No. She has no tenderness at the tragus site. And then I'm going to look into her ear canal, and I'm looking for any redness or discharge or swelling. And then I would come on that side to do this ear, because you want to look in both ears, and you're always comparing side to side. And then I notice that she has piercing in her ear. And do you wear any type of hearing aid at all? No. And so she has no prosthesis for her ears. Then I'm going to look at her lips, and I notice that her lips are pink and moist. Can you open your mouth? And I'm looking in her mouth to see that her teeth are present and intact, and her gums are pink and moist. And she does not have any foul breath odor. Okay? And then now I'm going to palpate for your lymph nodes. And so when you're palpating for lymph nodes, you want to use the pads of your fingers, and you just use a little rolling motion to see if any of the lymph nodes are palpable. And I'm going to start at the submental, and I'll roll it here, see if I feel any enlargement, and I don't. And then along her jaw is the mandibular. And then back here is tonsillar. And then in front of this muscle, there's a chain of lymph nodes called the anterior cervical. And then behind it is the posterior cervical. And then at the very back of the head is the occipital. And then here, where the clavicle is, just above it, I want to feel down in that area for supraclavicular lymph nodes. And I do not feel any lymph nodes that are palpable, which is a good sign. Okay? And that ends the head and neck. What did I do?